Part A. Extract 1. Questions 1 to 12. You hear a dermatologist talking to a patient called Mihiraa. You now have 30 seconds to look at the notes.
Hello, Mihiraa. Please come in. What brings you to see me today?
Thank you, Dr. Vance. I'm a bit concerned about my skin. It's been quite troublesome lately.
I see. Can you describe what's been going on?
Well, for the past few months, I've developed these really persistent red patches on my elbows and knees.
All right. Mihiraa, do they tend to cause discomfort?
They're quite scaly and incredibly itchy, especially at night. I've tried moisturizing a lot, but it doesn't seem to help much. Sometimes they can feel a bit sore if I scratch them too much. I've also noticed my nails seem to be getting thicker and a bit discolored, almost yellowish on some fingers and toes.
Noted. And have you experienced any joint pain or stiffness, particularly in the mornings?
Yes, actually. I almost forgot to mention that. My fingers and toes sometimes feel stiff when I wake up, and a couple of my joints, like in my knee, have been aching intermittently. I just put it down to getting older, but it has been more noticeable recently. Since they're quite visible, it makes me feel self-conscious.
I understand. Have you tried any over-the-counter creams or treatments for these patches?
I've tried various heavy moisturizers, including those meant for intense hydration and barrier repair, and even some hydrocortisone cream I had at home, but nothing seems to make them go away. They just keep flaring up. Despite temporary relief, the redness tends to return with the slightest trigger or environmental change. I've also tried using milder soaps and detergents.
That's helpful to know, Mihiraa. And regarding your medical history, do you have any family history of skin conditions or any other significant health issues?
Yes, my mother had something similar. I think it was psoriasis, but it wasn't as severe as mine seems to be. Apart from that, I'm generally healthy. No major illnesses or surgeries except for PCOD, which is being managed with metformin and Nordet.
Thank you, Mihiraa. From what you've described, particularly the scaly red patches, intense itching, nail changes, and joint stiffness, it sounds consistent with psoriasis. It's a chronic autoimmune condition that causes skin cells to build up rapidly on the surface of the skin.
Oh no. What do we do now?
To confirm the diagnosis and determine the best course of action, I'd like to do a skin biopsy from one of the affected areas, which will give us a definitive diagnosis. We'll then discuss various treatment options, which can range from topical creams to light therapy or even oral medications, depending on the severity.
All right, thank you, Dr. Vance.
Extract 2. Questions 13 to 24. You hear a neurologist talking to a patient called Mihiraa. You now have 30 seconds to look at the notes.
Hello, Mihiraa. I'm Dr. Finch, the neurologist. What brings you to see me today?
Hello, Dr. Finch. I've been having some really strange symptoms lately, and my general practitioner thought I should see a specialist.
I see. Please tell me more about what you've been experiencing.
It started a few months ago. I've been getting these episodes of dizziness, almost like the room is spinning. They come on quite suddenly. Sometimes I feel like I might faint.
All right. And how long do these episodes typically last?
They can vary, anywhere from a few seconds to a minute or two. What's really concerning is that sometimes I also experience numbness on one side of my body, usually my right arm and leg. It's not constant, but it's very unsettling when it happens.
I understand. And Mihiraa, do you notice any specific triggers for these episodes?
Not really clear triggers. They seem to happen randomly. I've also been having frequent and intense throbbing headaches. They're different from my usual tension headaches, sometimes come with sensitivity to light and sound.
Thank you, Mihiraa, for that detailed description. Have you experienced any changes in your vision, speech, or memory?
Yes, sometimes my vision gets blurry during these episodes, or I see flashing lights. And I've noticed I occasionally struggle to find the right words when I'm speaking, which is very frustrating. My memory also feels a bit off lately, like I'm forgetful of things I should easily recall.
I see. And have you tried any remedies or over-the-counter medications for these symptoms, Mihiraa?
For the headaches, I've tried regular pain relievers, but they don't really touch these new, intense ones. For the dizziness, meclizine, but for numbness, I haven't tried anything specific because I don't know what it is. I've just been resting when they occur.
Right. And your medical history, Mihiraa? Any history of migraines, strokes, or other neurological conditions in your family?
My grandmother had migraines, but nothing as severe as this. No history of strokes or anything else neurological in the immediate family that I'm aware of. I do have high blood pressure, which is generally controlled with furosemide.
Thank you. Mihiraa, based on your symptoms, we need to investigate this thoroughly. This constellation of symptoms could indicate a few different neurological conditions.
What sort of conditions?
It's too early to say definitively, but we'll consider possibilities such as migraines with aura, or conditions affecting blood flow to the brain, or even something like transient ischemic attacks, TIAs, which are often called mini-strokes. To get a clearer picture, I'll need to conduct a comprehensive neurophysiological examination here in the office.
Okay.
In addition, I will most likely order some imaging tests, such as a brain MRI, to look for any structural changes or abnormalities. We might also consider a carotid ultrasound to check the blood vessels in your neck. These tests will help us pinpoint the cause of your symptoms and determine the most appropriate course of treatment.
That makes sense. I just want to understand what's happening.
Absolutely, Mihiraa. We'll work together to get to the bottom of this.